We want to say hello to everybody out there in radio and TV land. This is a call to action. I'm your host, Alex Capersham, and I want everybody, if you're hearing this, if you're listening to this, then you need to pay particular attention to it because we're going to discuss a very, very important issue. Things are driven by information, and we have some information here that's very important to the community because it talks about health and it talks about an organ in your body that's very, very crucial to your existence. And I'm so happy that a group of organizations have seen fit, organizations and individuals, to really discuss the need for heart health. And we have some distinguished individuals on our show today.
My name is Monica Parker. I'm a family physician, geriatric primary care provider. I now serve as the director of the Minority Engagement Corps for the Goizueta Alzheimer's Disease Research Center of Emory University. Our mission is to engage more people, particularly underserved persons. These can be people who are of African American descent, people who are from the LGBTQ community, people who are from rural communities and not Metro Atlanta, let's just put it that way, to make sure that you are aware of how heart disease connects to brain dysfunction. All memory loss is in Alzheimer's. There is a little bit of a connection there, and our role here today is to try to explain what those connections might be.
My name is Phyllis Thurman, and I'm representing the Macon chapter of the Links Incorporated, and I'm also representing the Women's Heart Coalition for Middle Georgia.
Hello, everyone. My name is Douglas Rum, and I am the Regional Director for the American Heart Association for Central Georgia. And I'm excited to be here. I'm really proud of my community, and I'm really working with a lot of organizations to collaborate just to help people have healthier and happier lives moving forward.
They have introduced themselves, and we're going to move right into the nuts and bolts of the program. But let me just say this. Anytime there are resources and information that are out there to benefit the community, then we need to pay particular attention to it. Particularly when you have individuals who know what they're talking about, what they are doing, and whose mission and goals are to make improvements in those particular areas. So we're going to start with Ms. Kitchens. Just give us kind of like an overview of what this initiative is about and its mission and how it's driven.
Yes, Mr. Habersham, again, I am representing the Women's Heart Health Organization for the Middle Georgia area, and it consists of several organizations: the Macon chapter of the Links Incorporated, the Macon chapter of Zeta Phi Beta Sorority Incorporated, the Macon chapter of Delta Sigma Theta, the Macon chapter of Sigma Gamma Rho Sorority Incorporated, the Macon chapter of Alpha Kappa Alpha Sorority Incorporated, the Order of the Eastern Star, the Women's Missionary Society of the AME Church, Jack and Jill of America, and the International Association of Ministers' Wives and Ministers' Widows. And what we've done is we are a group of Black women organizations who have come together to bring forth increased heart awareness in the Middle Georgia area. And with that, we've partnered with the Central Georgia Heart Association, and also we've partnered with Emory Alzheimer's Brain Center, and we are going to bring the Middle Georgia area a webinar on February the 26th, with Emory being the sponsor, the Heart Association and the also Alzheimer's Association being one of our community sponsors. And so with us today, we have the experts. We have Dr. Monica Lauren Willis Parker, who is one of the very few Black researchers in the area of dementia. And then we also have Doug Rum with us, who's representing the Alzheimer's Association. Again, you know that heart disease is the #1 killer of women. And we also, as Black Americans, we are disproportionately affected by dementia, mostly vascular dementia. So I'm going to let the experts tell you more about those areas.
That's so outstanding. Thank you very much for that. And let me congratulate you and all of these organizations. You know, there's an old saying that says it takes a village. And you certainly have a lot of participants in the village addressing this important element of heart disease. Doug, tell us a little bit about the American Heart Association and its involvement in this process. And one thing I want you to pay particular attention to before we get to Dr. Parker is that I was just taken aback when I discovered, you know, how many people are affected by heart disease, you know, and a lot of people are affected and don't even know they are affected or being prone to being affected. So Doug, talk a little bit about that.
Well, our mission at the American Heart Association is to be a relentless force for a world of longer and healthier lives. And sadly, heart disease is the #1 killer worldwide, and stroke ranks second globally. So even if you don't die from either heart disease or stroke, it could have disability and diminishing quality of life with you for a long time. So we have to do a much better job of just changing the habits that we have in our life. 1 in 3 women will die from heart disease. So
Wow.
that our mothers, our sisters, our aunts, our neighbors, our friends. It's just crazy. And we can be better at preventing that just by changing our lifestyles, just doing little bits here and there. Again, the journey of 1,000-mile steps starts with just 1 step. So we can do a much better job of exercising more, eating better, drinking more water, just being more health conscious. So that way we can be more confident in our lives moving forward.
That is really outstanding. And, you know, Dr. Parker, I really didn't realize that there was a connection between vascular disease and dementia. You know, I don't know about the other people listening, but I certainly have learned something. So would you please talk about that connection and the role that your organization is playing? And then I know that African Americans and underserved people are adversely affected in a lot of areas, particularly in the area of health. So talk a little bit about Emorys Mission and your mission as it relates to trying to make a difference in that respect.
Certainly, happy to do that. One of the things that's important for people, all people to know really, is that there is a connection between heart disease or hypertension and brain dysfunction. I didn't say dementia, I said brain dysfunction. If you have high blood pressure, if you have high cholesterol, if you have diabetes, those are what we call cardiovascular or heart disease risk factors. Those very same diagnoses, independently and together, cumulatively affect how your brain functions. Specifically, they put you at risk for having strokes. And I think that in our communities, a lot of times people think of high blood pressure by itself, diabetes by itself, heart disease and cholesterol all by itself. But what we fail to realize is that these things work together to do bad. And one of the places they do bad is not just your heart, but your brain as well. So anything that affects the circulation and blood flow to your heart muscle to make your heart muscle work well also affects blood flow and the way your brain will function. So if you have poor blood vessels, you have cardiovascular disease, your blood vessels are small and you're not getting enough blood to your heart in order for it to work well, the same thing is going on to your brain. The same process that's going on in the blood vessels that supply blood to your heart is going on to affect the blood vessels that supply blood to your brain. So when we start talking about dementia, people say memory loss. Well, she's got that Alzheimer's. It's not Alzheimer's, it's Alzheimer's. But all dementia, and we recognize that this is a spectrum of disorders, has results in the same endpoint. So I might have memory loss, but my memory loss may not necessarily be because I have Alzheimer's. My memory loss may be more likely because I have poor blood flow to my brain. Maybe somewhere along the lines, I have suffered a little mini stroke or a TIA or some place where my brain didn't get enough blood. So when people say, well, nobody ever told me I had a stroke, well, a lot of times we don't know that we've had a stroke. But vascular dementia, or a mixed dementia that combines both Alzheimer's and vascular disease, has the same effect. Our brain doesn't work the way it needs to. And when our brain doesn't work the way it needs to, we're no longer able to take care of ourselves. So the end result of whatever type of dementia you develop, whether that's Alzheimer's or the vascular that's associated with strokes, frontotemporal or chronic alcoholism or chronic traumatic encephalopathy, the end result is the same. The person affected is no longer able to independently live, function, and otherwise navigate the world. So in our Alzheimer's Disease Research Center, I used to have my practice at Wesley Woods Geriatric Center. That's where I took care of people older than the age of 65. And I learned that a lot of the people who were at Emory University coming to see us at Wesley Woods were already involved in research. Now, what does research have to do with what you just said? Well, we're in the pandemic and we know a lot about how important research participation is in terms of developing the right vaccine, the right treatments to take care of COVID. The same is true for dementing disorders, whether it's vascular dementia or Alzheimer's or any other type of dementia you have. We need people to participate in clinical research trials to know about them so that they can participate and we can learn more about how different diseases affect different groups of people. Now, with respect to the heart-brain connection, we know that 20 years before anybody manifests signs of dementia, that means you're not thinking clearly, brain's not working like it's supposed to, you're not getting all cylinders working. There's a 20-year history of hypertension that is largely untreated, uncontrolled, poorly managed. And the sooner you control and manage those things that you can control, which is the connection to the heart disease part, the less likely it is you are going to suffer brain dysfunction later on. So the connection between heart health and brain health is a very close one. Outside of a stroke, there are other vascular risk factors that are associated with brain dysfunction. I don't know what all of them are. I've kind of enumerated some of them, but research is ongoing to see exactly how these different things work together to cause the brain not to work together. Beyond strokes, there are other things that cause your brain to misfire and not work well. So the reason we want to couple them, and this is why the American Heart Association is very important, they have a simple 7 for heart health. Think of that simple 7 as heart health and brain health at the same time, because what helps your heart generally will help your brain. Yes, you need to eat properly. You need to exercise 150 minutes plus a week, less saturated fats, more fruits and vegetables, more social interactions. Things that produce and preserve your heart function, preserve your brain function. And we want you not to think of these as separate and distinct entities. They all work together.
That is outstanding. And Phyllis and Doug, that kind of leads us into this activity and what's going to go on as it relates to that. And Dr. Parker, I really appreciate that. Information is powerful, and everybody got a heart and everybody needs to be concerned. And I had no idea about the connection between, and I'm dealing with that now, family-wise, with somebody with dementia. And it's just good to inform the public, how these things tie together. And I would think, Doug and Phyllis, either of you, that's the motivating and the driving force. And then I saw somewhere, go red for women.
Yes.
That's the motivating force behind this activity. So talk a little bit about, Phyllis, you can start because you got all these organizations, they're on a mission, and talk a little bit about the activity. And Doug, when she finishes, I want you to talk about how individuals can use the American Heart Association as a resource for information, activity, education, etc. Phyllis?
Yes, and thank you again. Thank you so much. And I'll let Doug also tell you about the Go Red initiative. But with this webinar, we are excited. And this is the second webinar that the Women's Coalition has put forth for the Middle Georgia area. There was one last year that we did that was called Women's Heart Health Matters. And we had lots of participation with that webinar. So we're excited about this one that's coming up. And the name of it is Healthy Heart, Healthy Brain, Healthy You. So we're putting all of that together and bringing forth, again, what Dr. Parker talked about, what you need to do to have a healthy heart. You need to also do that to have a healthy brain. So that webinar, again, is February the 26th from 12 to 1:30. We have Karen Greer from CBS 46 in Atlanta. She's going to be our moderator. And we also have some other panelists that will be there. We have a cardiologist, we have a neurologist, and then we also have our own Dr. Jimmy Smith from the Bibb County Public Board of Health that will bring forth, because we don't want to just give you information about the disease processes. We also want to give you information about resources in the Macon area. And Dr. Parker might talk a little bit also about the Georgia Memory Net. And she'll give you a little bit more information on that. But Doug, can you tell them about Go Red? Because we're excited about that. That's coming up the first week of February. We're gonna all have on our red dresses. The Macon links will be down at the marquee at the Grand Opera House. We're gonna light up the city with lighting up the links logo for Go Red. And we're also gonna be at the mayor's office on the 3rd with the proclamation for the city for Go Red.
Doug?
Well, of course. Well, Go Red for Women has been making an impact for women for 18 years for Go Red for Women. So, goredforwomen.org is the website. But really what it does is it helps raise awareness amongst women. It empowers women to take charge of their health. It engages more women in research and STEM, so the science, technology, engineering, and mathematics. And it also addresses inequities in access of quality of care. So again, when we hear about the figures of 1 in 3 women dying of heart disease and stroke, we know it can be prevented. So Go Red for Women is not just about wearing red or sharing, heart health facts. It's about women standing together for Go Red for Women, so that they can obviously just empower each other and be there for each other, but also do things differently. So February is National Heart Association Month. So, with Valentine's Day obviously being about hearts, that's where we can start to make some changes. February the 4th, the day that we're going to have the proclamation with the mayor, is National Wear Red Day. So you can do little things like I have the lapel on with the red dress, for women, but that's again where we can start to make some subtle changes. Some subtle changes that are moving forward. And there are some calls to action that we can do, like healthy living, just to mellow out and relax more and reduce stress. Healthy living to move to the groove. So reclaim your rhythm is what we're all about, especially for the month of February, because there's music and magic together. It helps us to move. So it helps us to rethink about doing some things again, even if it's just tapping your toes or whatever it may be, whatever's going to make you or help you to reclaim your rhythm. Also, healthy living is feeding your soul. So trying new recipes, better recipes, less sodium, less sugars and things like that. So for people to stay on your beat, so know what your blood pressure is, get your blood pressure checked regularly. You can go to the various stores and they will have the machines so you can see what your blood pressure is. So that way, when you go back and check it again, you see where it's higher or lower, but it's things that you can research for yourself and keeping the beat. So one of the things is we want people to be confident so that when situations happen, they know what to do. So an easy thing to do is to learn hands-only CPR. It's 2 easy steps. When you see someone who you think has had a cardiac arrest or has had a heart attack, first thing you do obviously is call 911. And then the next thing to do is just to get on their chest, clamp your hands together and push hard and fast until someone comes to help. So those are our calls to action for the month of February to help everyone reclaim their rhythm and just move forward to having healthier, longer lives.
Oh, that is so important. Dr. Parker, you mentioned those behaviors that very quickly, can you kind of go through them again as it relates to those things that we should look out for as it relates to heart health?
Yeah, well, one of the first ones is controlling your blood pressure, making sure that you know what your numbers are. Used to be your top number shouldn't be higher than 140. Well, now if you're diabetic, we know that that number shouldn't be 140. It should really be closer to 120. If you know your cholesterol, what's your cholesterol number? High cholesterol, high triglycerides, low high density lipoproteins means that you're at high risk for heart disease. So know those numbers and make sure that every year you get those things checked by your doctor. And if you're on medicine for your cholesterol, if you're on medicine for your high blood pressure, please take it like you're supposed to. A lot of people say, well, I got high blood pressure, but I'm gonna do it with diet. If you could have done it with diet and whatever it was you were doing, you wouldn't need the medicine. So until you have worked things out such that you don't need the medicine, please take the medicines the way your doctors have prescribed them. That is your high blood pressure medicine, your high cholesterol medicine, and your diabetes medicine. Everybody needs to exercise at least 150 minutes a week. That's something that we can all do. You don't have to join a gym. You just need to get up off your couch and stop watching TV, okay? Walk a little bit, stop smoking. So in terms of brain health, in addition to those things, controlling the chronic things that you have and taking your medicines like you're supposed to, we want you to stay socially engaged. Social interaction helps improve brain connections. Get your hearing checked. You don't think about this, but getting your hearing checked is real important for making sure that you interpret the world around you and stay in control of your faculties. So in terms of heart health and brain health, eat a healthy diet, exercise at least 150 minutes a week. Make sure you get at least 6 to 8 hours of sleep a night. I don't care. You can make it on 5, you can't. It's when you go to sleep when your brain clears out all the things that are poisonous, the A beta and protein plaques that are associated with Alzheimer's. You got to clear that stuff out and you got to go to sleep. So don't be proud of the fact that you can live on 4 hours at night. You need more. All right. Exercise, diet appropriately. The American Heart Association has an excellent guideline about what your body weight should be, what you should eat, sleep, check your hearing, stay socially engaged, do what your doctor tells you to do. If you're on medicines, do what you're supposed to do. If you had done it before, you wouldn't need the medicine.
Yeah, I understand. I hear you loud and clear, Doc. Okay, so I'm sure, Ms. Kitchens, that much of this information will come out in the seminar with those distinguished guests you're going to have. So will you repeat when that's going to happen again and how can one get engaged and be involved?
Yes, healthy heart, healthy brain, healthy you. February the 26th from 12 to 1:30. And you will be able to see information on any of the organizations that I named, their Facebook pages. Mr. Habersham, we're going to have it on the Black pages. So
Okay.
we will get that information to you and we will definitely advertise there so they will be able to see the information and get registered also from your site. And the Heart Association will be putting out information also. So hopefully you will see it all around Middle Georgia area. Before the webinar last year, we had people from all over the United States that were tuning in. So we're expecting the same. And please, if you register a friend.
That's outstanding. You know, it's amazing, Doug, and I'll let you kind of wrap it up. First of all, let people know how they can get in touch with the resource for which you are responsible. But give that statistic again, because sometimes I think, and Dr. Parker mentioned it, we don't realize the magnitude or the extent, of problem with our heart health. And I read the other day that African American women are more adversely affected and disproportionately affected. So give that statistic again and give information as it relates to how people can utilize your resource.
Well, it's heart.org, HEART.org, or goredforwomen.org. And again, the facts that are out there, the statistics are crazy. So for African American women, 1 in 5 are 3 times more likely to suffer from heart disease and stroke than a Caucasian woman of the same age. So again, it's all preventable. We can all do steps to help our lives, to help live longer. So again, remember that it's all about engaging other people. It's about collaborating. It's about educating people. So when you see someone doing something that can harm their life for the long term, talk to them. Be the help to empower them to do some other things. I know that one of the things that Phyllis is going to be a part of is Women of Impact. So what that is just a 8-week woman peer-to-peer fundraising campaign where they're, again, helping to empower women to do other things, to get more women involved in like the STEM, to more women involved in knowing about their own health with their body as it relates obviously to heart and other things. But it's also a fundraising campaign, because what I need to do is we need to raise money, because we all know stories. We all know the stories of the bad stories of how things ended, but we're also hearing the great stories of people that suffered a heart attack, but someone, because they knew CPR, was able to help save their lives until someone was able to come. So it's a matter of changing the way we're doing things better, being receptive to changing and doing other things. So all the resources are out there. It's just a matter of us doing what's necessary to take the reins and make the changes necessary in our lives.
This is a call to action. I want to express my deepest appreciation to Dr. Monica Parker of Emory University, Ms. Phyllis Kitchens of the Links, and Mr. Doug Rum of the American Heart Association. Take heed. We all want to live a long time. The information is phenomenal. And if we change our behavior and take heed to the information, I don't know about y'all, but I want to live a long time, even past this gray hair. This is a call to action. I'm your host, Alex Habersham. Have a great day.
www.makingblackpages.com